Warm, warm greetings, everyone. I'm Dr. Sudhir Sapkota, pediatric hemato-oncologist from Kanti Children's Hospital, and I'll be your facilitator for today's program. Very good morning to all the participants from Nepal, and good evening to all the participants from Canada. Today, we have entered the fifth week of this pediatric palliative care to ECHO session of Nepal, and we are very grateful for your wonderful participation till date, both on the event day and also for our active participation in the chat, in the WhatsApp, even after the program also. The wonderful news for Nepal has been that we had a vaccine rollout last week, and we hope that all of you have got the vaccine first dose already, and none of you had complications. I only had chills without fever though, and it's wonderful to get the vaccine. Today, we have got a wonderful camera with us, and she will be taking us the class on play therapy and building relation. Along with that, we have host as Saskruti and Chalk. Co-facilitator will be Dr. Shani for today's program. After today's program, key learning points will be collected by Vijay Dhakal. And please be active in the chat. You can put forward your questions in the chat, and facilitators and other faculties will be there to answer it. And basically, Dr. Spandana, Dr. Megan, and Dr. Ishak will be there to reply to any queries today. Timekeeper will be Dr. Sunny, and Saskruti will be there. And we have introduced a new breakout room with discussion today. It hasn't been in this ECHO session earlier, but we'll have a breakout room after the cameras speak today. Regarding the Zoom, please keep yourself mute when you are not speaking, and as mentioned earlier also, use your name for the purpose of attendance. And again, I would like to request you to be more active in the chat. So let me start today's program. Today we have got Kamara Van Brim. She is a nurse practitioner and play therapist. Kamara, please start your talk, and along with that, please let our participants know what actually you do in your hospital, because we are new to this term play therapist, as most of our hospitals do not have a different play therapist. Over to you, Kamara.
Thank you, Sudhir, and hello and good morning to everyone. Yes, I am a nurse practitioner. My background is nursing as well as psychology. And I've worked at Canuck Place Children's Hospice for many years and have had different roles there, including a staff nurse and a play therapist and counselor. And in 2007, I did my master's in nursing to become a nurse practitioner. And so I lead our team with our home program. So I do coordination across locations all over the province, as well as planning and care in children's homes if they want to be at home. So in terms of play therapy, that's what we're talking about today. I learned actually when I was working in grief and bereavement about the importance of play. And in my nursing education, I did not learn about play. I learned about development and I learned about milestones, but I didn't learn a lot about play. And I was very curious when our grief therapy groups were all done around the themes of play. And what I learned is so much about play, not only all the wonderful things that play does for children, but that play is actually super helpful in children's healing, in their grief and in their illness. And if we allow space and time for children to play, so much happens, so much in communication and in so much in in knowing who the child is. So I decided to become a play therapist and got my master's in psychology and did a certification in play therapy, and did private practice for a number of years. And I always say that the children have been my biggest teachers. So today we're just going to talk a little bit about play, and my hope would be how you guys can integrate that into your settings. Next slide. So we're going to explore the principles of communication with children who are seriously ill. We're going to discuss engagement with children through talking and play, review important aspects of psychological care, and provide, throughout the whole thing, I want to provide art and play examples that hopefully you can incorporate into your everyday work. Next slide. So some of the important principles is we can't play with children and be with children and play until we really look at what is their development, what are the concepts of death and dying to children. For a 2-year-old, it's very different than a 12-year-old. What is the illness context? What is the family structure? And what is the culture and background? Prepare yourself when you're going to play with children around this. The next thing is to be curious. Tell us what you know and understand, and tell me how you like to spend time. So again, just because a child is 6 years old, he may or may not like what other 6-year-olds like. He may or may not understand what's happening to his body or why he's in hospital. And so we need to be curious and figure out who they are and what they like to do. I often say playing and being with children, with ill children, you have to be courageous. Often I get asked the question, but what if a child asks me about their dying? What if a child asks me if their cancer is back? And I always say, if they ask you that, it's because they trust you. It doesn't mean they trust you to tell them the answer or even perhaps know the answer, but they trust you to be with them. So that is the most important piece in being and staying with children in play. I also feel supporting parents is important. We often find parents are worried if we talk to their children about their illness or work with their child around what's happening. And so we have to really go to parents and say, what do you know about your child? Tell me what helps him and what hurts him. Tell me what he's like before he was sick, and tell me what you think is going on. Supporting parents, if we don't support parents, we cannot get close to the children. And so it's very important to remain non-judgmental and supportive of their approach to care. We may, once we get involved with parents, be able to support and move them through more understanding about what children need. And so growing that relationship with the parents is integral to communicating with children. And then super important when you work with sick children, self-reflection. What are my own triggers, biases, gifts, and ability to play? Am I really comfortable with working with a 6-year-old that is nonverbal? Or do I tend to be more comfortable with adolescents that are verbal? What am I good at in processing and working with children? Next slide. Starting and building a relationship. I talked a little bit about this, but starting with parents and engaging with parents and respect what they know and understand. I've also said consider illness, age, and development, and think about how long your session might be. An hour is way too long for a directed session with a 4-year-old. But you might say 20 minutes of doing an art project with a 10-year-old would be a really good length of session, depending on how well they were feeling. Come prepared. What is the purpose of the session and what might come up? What supplies do I need? Non-judgment and unconditional positive regard. This is really, really important. We call this client-centered focus, meaning I am not going to direct, I'm not going to lead, I'm not going to evaluate. I am there to be a mirror to what you're doing so that you understand better what you're thinking and how to solve your own problems. And then follow up and documentation and debriefing. Sometimes when a child does a really important piece of work, we have to consider whether that is something they want to keep, something they want to file, something they want to keep secret or confidential. We shouldn't post kids' pictures or artwork unless we have their agreement. Remember, their play is their counseling work, and we have to treat it with that integrity as well. The other thing is who are you debriefing your work with? Who is helping you understand what you might have seen or witnessed or what you're doing with that? So really gain some good relationships across the team with your psychologists and your social workers and other people that do counseling support. Because again, this is an interdisciplinary approach to supporting the child and family. Next. When you're using play, you're going to see different themes come up, and you guys will have access to these slides after, but just a few of them are family relationships, power or lack of. You see a lot of expression of anger and frustration, control and safety. You know, I had one child that the parents were not telling her about her cancer, and there was no discussion about it. And in her sand tray, she had a hospital bed on one side that she was in, and her family on the other. And in the middle was a lion. And I asked her what the lion was, and she said, "That's my cancer that's keeping me away from my family." And so you'll see themes around how much control or safety they might have or not have. Exploration and mastery, and then interaction and isolation. Next one. So I'm going to get you to write in the chat. Sadir wants you to write in the chat. So can you guys just write, you don't have to write all, you don't have to answer all those questions, but just a little bit, perhaps a favorite game that you have right now or in the past, favorite person to play with. What's your comfort level in playing with these ages or playing with nonverbal children? And is there any kids in your care right now that you are currently playing with, that you are engaging with in a playful way? Is anything coming up in the chat? I don't actually see my chat right now. So what's your favorite game that you had as a kid or that you are enjoying right now as recreation? Most adults still do play, maybe not as much as children, but board games. So there, we can go to the next slide. I'm going to talk about 4 important themes about what seriously ill children want. And I would say in general, this is what children want too, but we're talking about seriously ill children. So the 4 things are attunement to physical and emotional pain, touch and being in touch, truth-telling and safety, and life review. And where I get these themes from is actually from a colleague of mine named David Kuhl. He's a colleague and a friend who wrote a book called What Dying People Want, where he studied adults who were dying and about the themes that came up in many interviews that he did. And so many of the themes I think really apply, and I find this super helpful when I'm working with children to think what it is they need. Next slide. So attunement to physical and emotional pain. What we do know is if the child you're working with is in physical pain, they cannot play. And if they cannot play, they cannot attune to their emotional pain. So again, another reason why our physical care and attunement to physical symptoms is so important. Having the child decide what helps and what helps them and what hurts them is super important. So you can see on the right-hand side that I did color how you feel. And in that picture of the boy with the yellow crayon over most of him in a wheelchair, the yellow is indicating that it shows he's happy. Yellow is a sign of happiness in this drawing. And so he shows everywhere and everybody that he is got a happy face and a happy body. But when exploring more, he showed both anger and sadness in his legs. He was a boy with muscular dystrophy who had recently gone from walking to a power chair. And his feelings around his emotions were deep inside him. And so this drawing helped us explore what that was like for him. The balloon, I'm afraid he's going to die. This was a work with a sibling who we did feeling balloons, and the red balloon was for anger. And when we explored more, that is what he wrote on it. The left-hand side is a feeling volcano. And so we made a volcano out of clay, and then we got vinegar and soda, and we put spoonfuls and spoonfuls of soda, baking soda, into the volcano. And each spoonful was the anger this child felt about what treatment they were going through. And then we poured in the vinegar, and of course you have a great mess that's super fun to then work through and work in. And so this idea of expressing your emotional pain is super important. The middle drawing there is things that make me feel safe. And this child identified the mum and the stars and some animals. Next slide. Touch and being in touch. Again, if we're not attuned to physical symptoms, children can't be touched and held and played with in the same way. Really, sometimes we actually have to support parents in holding and touching their child, especially when they've been so sick that touch hasn't been good. We know this happens in ICU settings where the child has been, under critical care and not really getting a lot of touch, and how that is so damaging to the child. So encouraging touch is really important. And then being in touch is also, how do I stay connected? So draw me or show me who your family is. Which animal are you? If everybody in your family was an animal, what kind of animal would they be? What would your mom be? Would your mom be a lion or a tiger or a bunny rabbit? And having those figures that are on the left-hand side there can be really helpful for children to be able to show you who's in their family. And not only that, when they put their toys in a sandbox, it actually can also depict their relationship, their closeness, or their divide from the people that are in their life. So draw me or show me your family. Doing something is a really good activity. On the right-hand side on the top, that's called a trust target. And you put yourself in the middle, and then you draw circles out. And this was working with a teenager about who is closest in their trust target, and who was the people that they trusted a little bit, but not fully, and also out to who are the people that actually you don't trust or that you worry about because perhaps they haven't been true to you. Next slide. Truth-telling and safety. We had a session last week about how do you tell an adolescent, how much information and all those things. And again, we really have to be curious about first understanding what the child knows before we share our information. And what we know about children in development is sometimes their ideas are very bang on, and they absolutely know exactly what's happening because they've overheard all the adults in their life talk and share information. But because of development and ego and a whole bunch of things that in children's lives, is sometimes they have the facts all wrong. And particularly with younger children, they might actually think they caused the cancer, or they did something bad and they lied to their parents, and that's why they're sick now. So exploring with them through play is super helpful. The activity on the right-hand side is called the Think, Feel, Need exercise. And we did this activity with a group of adolescent boys, one who was going through back surgery, rod surgery for his muscular dystrophy. And other boys in the group had already gone through that surgery. And so together we did this activity called, what do you think about? What are you feeling about this upcoming surgery? And what do you need? I don't know if you can see at one point, but these are teenager boys. I think it said hot nurses or something. So there's sometimes what they need and what they can get doesn't always happen. But again, the focus very much being on, please tell me what you're thinking. Please tell me what you're feeling. Draw that, color it, use words. And then what is it that you need? What will help you get through this? The lower piece is on, we had a wishing tree in one of our retreats that we did with kids. And these were things that the boys wished for. One, you can see, I wish I could walk. Internal life, which I think he meant eternal life, a cure for everything. So expressing those wishes can be a really helpful exercise too. Next slide. Life review and legacy. What we know as anyone approaching end of life needs and wants to do life review. It is an automatic thing. And I don't mean life review in the way that we're just, oh, it's so, we're talking about this and we're getting close to the end. Life review is telling your story and hearing your story. One of my favorite questions to moms at the bedside of their child is, I'll say, oh, tell me what your pregnancy and your birth story was like. And if you know children, they all want to hear how they came into the world and what kind of fuss was made over them on their birth, their day of their birth. And so really giving kids an opportunity to hear and to review what they've done and how they've made a difference. This is a really extraordinarily important piece of work. One of the things that I've done is I cut out a bunch of shapes. If you know the life game that has the road and you get babies and you get different careers, I cut out different pieces of road and I asked them to go through different times in their life that were hard, that were good, that were difficult at different times, and we paste those together. And it's on the top corner, and you can see that the pieces, the stickers that stick the road together, we actually talk about how did they get through that? What are their gifts and their resilience in getting through that? Another activity I do is past, present, and future. This gives you a really good idea of what their life was like before, what they're experiencing now, and what they think might be occurring. And again, more often than not, they know a whole lot more than we think they do, or they'll share more than we ever could have done if we used words. Kids want to know, will I be remembered? And it depends on the age and their understanding. But some adolescents will want to do some letter writing or legacy videos. One of the things, we had a yearly teen group for our boys with muscular dystrophy. And every year we would have a memory table where we would remember their friends. And this became an extremely important part of our retreat because the boys that attended knew that they too would also be remembered and that they mattered. So that longing to belong is a really super important piece of work. And I know my time is almost up, I think. Next slide. Look at that. I'm so organized. We're going to do a breakout group pretty soon. I wanted to stop for a second and see if there was any questions about the content that I gave before we move to breakout, or what's happening next. Do we do breakout rooms first, or is there another presenter?
So
Sadir?
the breakout rooms.
Okay, so let's just, any questions or comments about all that material that I feel like I rushed through? Anybody? You can ask your question in the chat too, if you're. Oh, I see we got lots of good games. Hide and seek is an excellent game to play. And you actually can always make it more interesting by hide and seek your questions. So I will sometimes, to open up discussion with kids, will say, let's have a question jar, and you put the questions in a jar, but you always plant a few questions that you think might come up. But you also can hide questions around a room or in special places. So, what do you think happens after someone dies? And you have a group of kids that are playing, and you might get 3 different answers to that. Or, why do you think people get cancer? So question jars are really important because they give you an opportunity to kind of hear what that child might be thinking, but that you might also be able to clarify things that are inaccurate. Any questions or comments? Everyone's so quiet. I'd love a question.
I want to ask
Hi.
a question. Oh, go ahead, Isha.
Okay. When you play with children, the hide and seek example that you were giving, if 3 children give 3 different answers, then they look up to the adult saying which one is the correct one. So how do you respond to that?
Well, how would you respond if someone said, well, I think you're reincarnated, I think you go to heaven, and I think nothing happens? So how would you respond, Isha?
I would tell the child that I'm not really sure of where we go, but usually what we believe could be true or something like that. Probably what you believe is important, and probably that would happen to you or something of that sort.
Yeah. And one of the things I learned about kids is they do want you to comment, but they mostly want to be heard. So I would just reflect. I'd say, well, Johnny thinks reincarnation. What are you coming back as? And Henry thinks that you go to heaven. Wow, I wonder what that place is like. And you think dust to dust, or whatever happened to say. Sometimes kids will push us to say, well, what do you believe? And again, it's about the dialogue. It's about exploring. It's not about having the right answer. But sometimes, especially when you have quite a close relationship, a growing relationship over time, they might push you to say, well, what do you believe? And again, that's your comfort, your professional comfort in knowing, would it help them to know what I think, or would it not help them to know? And so those would be the things I'd consider. But you're right, who knows? Nobody knows what happens after. That reflection is super important, and it just opens up dialogue. Hope that's
Thank
helpful.
you.
Any other question, and we'll go for a breakout room pretty soon.
How do you choose the kind of play if there is a group of children who belong to very different age groups? Do you keep them together and then let others hear what the adolescent has to say, or a toddler, or a younger child has to say, and then you mix them up, or you separate the age categories and decide what game or what play they would like for each other?
That's an excellent question. And one, I would say it depends on manpower. The smaller the children, the more men or women you need to help. So, and if you have very divergent ages, it also helps to have more volunteers and more support. So I would say you can, if you're just doing kind of a simple game that doesn't require a lot of hand over hand, you can do quite a number of children. Let's say it was, make a sound like an animal. What animal are you? You could have a good kind of play time with different ages. And you might have a 14-year-old that doesn't want to play that, but you could say, hey, Raju, why don't you sit by Henry and actually talk to, support him in playing this game. So, having kids be together in different ages is got an advantage. I remember one grief group I was running, and we always start with a talking stick, and we'd say, my name is, and my dad or my brother died, and or I pass. My name is Camara, and I pass. And we'd pass the stick around the circle. And the older kids would always say, my name is, my brother died. And that's how they would say it. But we had a 4-year-old who really wanted to start the circle. And he said, "My name is Charlie and my brother's dead." And the way he used those words made it very different than "my brother died." He made it sound very permanent. And that actually shook kind of the whole group, because this little kid actually said it in a much more real way than the rest of us were doing. And so that was how the whole rest of the group went. So I'm not really answering your question other than to say, look at who's around. You might take 2 or 3 kids off on their own to do bubbles or big energy play, or you might decide that there was an activity that you could do with a lot of them. If you're doing a real specific therapeutic piece of work, like I described with some of the muscular dystrophy boys, it's good to kind of have some commonality, similar diagnosis, similar cognitive ability to share, if you're doing a group process. The other thing to consider, and this will be my last thing to say on this, is if you're doing a drawing or something, you can just say, everybody draw their family. So a 4-year-old can draw their family and stick people, and a 12-year-old can put a lot more detail. And then you'll say, okay, now we're going to share about the family. So a 4-year-old and a 12-year-old can share about their family and who's in their family. And that's an activity that you don't have to sort of think about. You just know that the sharing will be a little bit less or more detailed depending on the age. And I would say in a group setting, when you're doing sharing, always give the option of passing. So you can share or not share. Please share if you want. If you don't want to watch, just be a good listener and pass when your turn comes. Hope that's helpful.
Thank you, Kamra.
Thank you
Thank
so much.
wonderful presentation. We'll get back to the discussion again after the breakout room. So we'll have 6 breakout rooms now. All the participants will be divided into 6 different rooms, and in each room there one facilitator will be available to moderate the proceedings. And for discussion, we have, as Kamara has pointed out in our last slide, the points for discussion will be: discuss 1 or 2 of the ideas that you feel you could institute in your setting, which activity and which child, as we have seen lots of activities that can be done for play therapy. We can discuss what are the things that can be instituted in our setting. And the next question will be, how will you introduce this to the child and parents? It's something like we are not habituated to instituting play therapy to children. In fact, we are also not confident enough. So how would you like to start it? How would you get yourself comfortable and make the parents comfortable? So we can discuss it in the second point, and who can support you in this. So this will be the third point. So we'll start the breakout rooms, and we'll have 80 minutes for breakout rooms. So we expect more participation, active participation from all the participants, and we'll ask one representative from each group to summarize after we end the breakout room. So we'll enter the breakout room now. welcome all. Hope you had a nice discussion session, but maybe this breakout room is something new for most of the participants. So we had some, might have been unaware how this breakout room will work out. But I think everyone has participated well. So now we'll take participants from one representative from each group who will be sharing a short for just 1 minute discussion about what were the main points discussed in their group, and following for the other groups you can add to the points that are not mentioned by the earlier groups so that we won't be having any repetition. So from room 1 with Dr. Megan's room, anyone would like to volunteer? Giora, would you like to?
Yeah. From our group, we have discussed several ideas that we may have done already in our current settings, and also we have tried to share a few ideas also that we would like to try. So one of the ones that we have mentioned are colored drawing, which are very easy and effective for our patients. And also, Dr. Krishna shared about um, his experience with kids, having them try musical instruments in their place, where the children can just play the drums, even though they don't know how to play it. Also, we would like to try the trust target for the adolescents, and basically also the balloons balloons and yeah, I think that's the general thing that we have discussed.
Yeah, thank you, Giora. Definitely having balloons in our area is very charming for the children. Now let's move on to the room 2. Dr. Madhusudan, would you like to highlight few points that you had discussed in your group?
Actually, we have playrooms in this outside OPD. We have discussed like that, and actually, there's no space, open space for children in our hospital. And currently, this pandemic situation, it's also not practical. And in our group, Dr. Prakash has said that he's in working in DB Koyala Hospital, and he has enough space where child can play, run, and spend their time. And in my hospital, if I have to say, we have a small playroom outside OPD and different wards. Like in hemato onco ward, we have a playroom. And as far as I remember, they are mainly focused for the little children's, and there is no categorized plays, toys for uh, children. That's it.
Thank you, Dr. Madhusudan. Definitely, we do have a play area, but we don't have any age-specific play material for different age group of children, and we don't also have any play therapists like Dr. Kamara accompanying the children. Actually, it's a messy area, and children are playing whatever they want to do, doing whatever they want. And now let's move on to fourth room. Damodar Tiwari, if you had time to discuss on the second and third points, would you like to brief about those points? Who would you like to ask for to have a play therapy in your room, in your playroom, in your hospital? And how would you like to introduce play material to the children?
Okay. Actually, the concept of play therapy room is not well established in our center. But we had discussed about the art the simple art we asked the patient, those who can draw art, they will be happy with their art, and we will provide some sport and some other writing board, and uh, they will draw some art, and they will project their feelings on the art. We had discussed like that, and definitely if we had some support play therapist, they will make children happy during their medication. Uh, like this we had discussed. Thank you.
Thank you, Dr. Damodar Tiwari. Actually, such easily accessible things like play therapy may not be available round the clock in our ward also. So we should have such resources available with us. Now moving on to the room 5, we have Isha Bister. Would you like to discuss any new things that have been discussed in the room?
We'd spoken about how widely art is used and how it's cultural free, it's easy accessible in hospitals. We spoke about that. The other thing Spandana spoke about was how they used balloons and how adolescents were in charge of younger children, that everyone should get one. And children were expressing their anger through balloons. So I think that was a very good idea. Other things we spoke about was stories, how children enjoy them, and that parents could support them while playing. Thank you.
Yeah, definitely reading out stories is also a good form of play. Now moving on to the last room, Srijana Goshen. Dr. Srijana, would you like to highlight the points discussed in your room?
Actually, in our room, I think we discussed, like, we do not have a separate room or a separate person allocated for the play therapy. But then Dr. Ishak gave us the idea about non-directive play therapy, which can be done on the bedside, like doing some art activities or drawings with the colors focused for different emotions. Basically, we highlighted on those things, and Dr. Vidya also said about how it is being done in her setting, that a child draws the situation that is going around. So it does not necessarily have to be a for the play therapy, but we can just utilize whatever we have, especially in a resource poor setting where we do not have play therapy room or therapies to play with the children. So in those cases also we can, how we could do it, the non-directive play therapies. These were some of the points which were highlighted in our groups. Thank you.
Thank you, Dr. Srijana. Wonderful discussion you had in your team. Now we are coming to the end of the session. So if we have got any other further queries for camera or any other faculties, you can raise your hand or you can unmute yourself and put forward your questions. Or if you have any questions unanswered or anything left for discussion in the discussion breakout rooms, you can put forward those questions. We'll be taking quickly 2 or 3 questions.
Hi, I would like to ask Kamala. So, is there any video, or is there any material you'd like to suggest, like, to for ourselves, we could engage ourselves in play therapy in whatever resources and whatever setup we have right now. That would be a very good step for starting. So, do you have any idea, could we see any videos or any materials that would help us incorporate play therapy in our setting, in the recent future?
Definitely, we could put some together. I think having a list of suggested items is helpful, and suggested, if people want to purchase certain things, I think having kind of a list is helpful. We could also do some video. One of the nurses I work with is here, and we could do some videos that we could share with you around sort of leading a play therapy session, what that might look like, and potentially use, have children that consent to using, some of theirs. We could definitely do that's of interest. I think one of the things I feel so heartened about is Hyderabad. I've been there twice, and I know that other people have worked with this team around play, and Hyderabad is doing this play now, as Spandana has shared, and so part of it is having kind of the courage to do it and to step into that role. So if videos would be helpful, we're happy to post some of those and work on different different examples that you can see and then do yourselves. Would that be helpful?
I think so. Yes, something would definitely better.
Yeah. I noticed one of the questions was about keeping the, with COVID, it's harder to play, and we're actually being very careful about washing toys and having toys that wash and things like that. But interestingly, our counselors have been able to do some Zoom play therapy sessions. So having the children with a set of supplies and then coaching them and doing that session over Zoom is actually very possible. So for example, you could get a child with paper and pens and saying, draw your family doing something. And after they draw it, you explore what that's about and who's saying what and what's happening in the picture. So just to say that in person is probably best, but there's other ways to also explore that as well in this time of COVID.
Definitely.
Just an
Yeah.
idea came to my mind. I don't know if this has been tried before or if it is helpful. An idea came to my mind, like is it helpful if patients would have like a body system, like at who's someone who is a teenager can be look after like a big brother or a big sister to a younger kid in the hospital. I don't know if that works or if it's something that would someday make them sadder. I'm just thinking if it could be like a support system also among the patients in the ward. Has it
Well,
been
I
tried
thank you.
before?
Yeah, thank you, Shahara. I think we know that particularly when children are in a setting for a long time, they're going to build relationships with other children and other family members. That happens automatically. And actually play is an automatic thing. And you will see that children will begin to play with each other as they get to know each other. And I think that's a wonderful support system. What I would say is, some of those relationships should be supported. I mean, if you have two teenagers that become very close, or a 10-year-old and a 16-year-old that become very close, and one of them gets sicker or perhaps even dies, how are you going to support that? And again, an example of play in that circumstance is if that 16-year-old's getting sicker, you might spend time with the 10-year-old and say, your friend is getting sicker. Do you understand why? What's happening? Tell me what you know. And I'm wondering if we could draw a picture around some of your favorite things about your friend. And we could maybe put that under his pillow so that he knows that these are the things that you're thinking. So, there's got to be support in those relationships. And so that's what I would say.
Yeah, thank you, Kamra, for that. Definitely that support system would be helpful. And any quick thoughts from other faculties before we wind up today's program? Dr. Krishna Sagar, would you like to add something, how the play therapy or the playroom has been managed in your setup? I don't think he is not with us. Dr. Spandana, would you like to add few points how we have got the play therapy conducted in your setup?
Yes, Dr. Sudhir. As some of you have said, even we don't have a separate room for play therapy. It is under construction for 3 years now. So we use our pediatric palliative care OPD. Just before we close, we are a bit more free. So from around 3 o'clock or 4 o'clock, we call the kids to the room. And some of them are on chemotherapy. So we say, tomorrow you can join, kind of thing. And once they come to the room, based on their ages, sometimes we separate them and we start engaging them. So it is me, my nurse, and my social worker or a counselor, whoever is available. And we see a lot of difference the next day when the kids see us and they're like, what time can we come? So we have to tell them, please have your lunch and we will call you, kind of thing. So kids look forward to these sessions. They make a lot of difference, especially with these huge busy wards where they don't find, like our hospital doesn't have a play area. So this is the only time they can even attempt to play. And the other place that they play is by their bedside. So that is the other. So sometimes we try to make them play at their bedside with the person next on the next bed. So what one of our team member has done is they identified 3 children who were quite close. So they gave them 3 puzzles and they said one of them is responsible for handling the puzzles and all of them get turns. And as one of you have pointed, adolescents lose role. They don't know what their life is meant to be, and they have no control over any of those things. So giving them some responsibility makes a lot of difference for them. So few of my thoughts.
Yeah, thank you, Dr. Spandana. Dr. Vishnu Giri, are you there? Would you like to add some points how we have play therapy in Kanti Children's Hospital?
Thank you, Dr. Sudhir. I'll be very brief. And we have a dedicated playroom in the oncology ward, and it's not very big, but it is there, and that's the first thing. We also use it as a counseling room at certain times of the day. So in that one, we had a volunteer. We had a human resource supported by a organization of our residents that was helping us run the providing a play therapist who was trained social worker, and that was quite good. For a few hours of the day she would engage everyone in the games according to age appropriate games. But now that has been discontinued, and what we are now thinking is we will probably train some of our nurses, almost all of them, and dedicate some focal person among the nurses to lead play therapy. And we'll take help from our psychologists and other organizations also to develop our permanent kind of workforce from the nurses. And we will, our activities, as Dr. Shani has already mentioned, includes drawing, giving balls and building blocks. So there are many kinds of games, and we are also thinking of, if our resources allow, engage the children in some kind of academic or teaching learning activity for those who are capable of it. And although that's not a play, but somehow it may contribute. That's the plan. Let's see how things go. With help from everybody, we would be able to do. Thank you.
Thank you. Dr. Krishna Sagar, would you be very brief?
Yeah, I am almost at the inch, beyond the time. So we have one play room for the palliative care side used for both adult and pediatric. So we have almost many toy and other things in the palliative side. But in the curative side and pediatric side, we have the separate corner where we are doing the counseling and free space for the dining and something like we use this. And even I use the whole ward at the same time over the bed, just like balloon games and play and singing also in the same area, the big room. And we have one volunteers from last few months to engage the kids. She's very interested in that. She's one of our survival osteosarcoma. I did almost 10 years back, and she completed class 12 and she want to join us. Very interestingly, her mother and father both are HIV positive, and father died. Mother is still alive, and they have the 2 children, one male and one female. The brother and sister both have the osteosarcoma, I try my best to survive his boy brother also, but we couldn't make him survive. He relapsed and long mates and expired. So she the only kids, and mother is positive, but he's complete class 12 and want to volunteer with the survivals and kids in the world. So she's very interesting case for me, and she's very interested to work with the child, but they need lots of support. But she come up with the support and play with the kids. So she's tried to engage drawing, playing other things from the last few months. So we hope maybe we can engage her in other more training for play therapy, something like that, so that she will be our support, maybe support kids for a long time.
I would like to meet her, and we could work together maybe when I come to visit.
Of course, I can connect you so you can ask her if she's writing one proposal for how to make engage the kids. So I give the she's just trying to how she could have shortly.
Thank you, Dr. Krishna Sagar. And for camera, we desperately need you here in Nepal and in India also. So once you come here, I don't think we'll send you back again. We'll keep you here. So thank you, Kamra.
I'd love to come, and I'm really, really pleased that you guys are getting your vaccines. That's so good.
Yeah, all of us has taken, I think, with minimum side effects. I got the fever and chills almost 3 days, and 103 fever 2 days, and then pain. So, but I am doing well now.
Yes, that means you're good. Then you've got the protection.
Yeah. We should wind up today's session. Thank you, Kamra, for a wonderful presentation, and thanks everyone for your participation. And we have tried out the breakout room and hope it has turned out well, and we'll be using this in other sessions also. Thank you everyone for the participation, and thank you Saskriti for hosting this program on the background. Thank you all. We'll meet again in 1 week time, and for the faculties we'll have a quick debriefing after this. Okay, bye. See you all again.
Bye.
Bye.
Bye. Thank you.